Question. With regard to the incident this past Friday evening, since the onset of COVID, the executive branch of Rhode Island government has largely taken near control of virtually every aspect of our reaction to this disease. And on almost a daily basis, there's been a steady drumbeat of distancing, play by the rules, don't go out if it's not necessary, and an ever-changing, if you will, banquet of rules and obligations to follow up with. On the onset of the pause, it was made very, very clear that the situation, and most would agree, was tenuous at best and approaching disaster. So there are a few things at question here. The spirit of the 33% rule was clearly observed at Barnaby's. The spirit, though, of unnecessary contact outside of your immediate home was violated. But as importantly, and it sent a clear message to restaurants everywhere, and I'm going to quote your rules, restaurants may not operate any recreation or entertainment activities and must prevent customer access to such areas on site. That rule was thoroughly violated by the very organization that was promulgating it and creating an element of fear around the Rhode Island retail business community that I haven't seen in my lifetime. What would you say to Rhode Islanders about that?
Yeah. So, as is often the case, we see things differently. You know, what I would say is I'm following the same rules as everyone else. So my rules, as I have said, stay with your household. That's what I was doing. Wear your mask. That's what we did. And follow all the rules. So that is what we've been doing. I've also been asking Rhode Islanders to shop local, which is what we were doing. So I hear you, but the rules are the rules, and I follow them just like everybody else.
But restaurants may not operate any recreation or entertainment activities.
Stefan's been through this over and over. There was no violation of the rule that night, and he'd be happy to talk to you offline about that. Brian.
Governor, on schools, last week you were pretty harsh again on the schools that were going to distance learning. In the days leading up to that and the days since, more and more have done more distance learning before the holidays, after the holidays, and then as you just said, RIDE came out with the new rules that say there can be more of that. So in hindsight, do you think you were too tough and not being fair, but do you think it hurts the productivity of the situation? Have you reached out to the superintendents? Either RIDE was acknowledging they were right in seeing the writing on the wall with staff situations and cases, or the superintendents just got ahead of it and are now driving the bus. Were you too hard on them?
So I think the answer is both are true, which is to say, I believe firmly, I have from the beginning and I still do now, children need to be taught. The best place for kids to learn is in school. Schools are safe as long as we take the proper precautions. And our principle from day one has been as many kids in school as long as possible. And listen, most superintendents, they're all working like crazy and doing their best. I have not made a secret of the fact that in certain places, Pawtucket, Warwick, I have been disappointed. I think they could have done better. Having said that, the majority of kids have been in school the majority of time. What we did in partnership with superintendents, and yes, I reached out to them, and yes, I explained that my comments were in no way intended to offend anyone or discredit all their hard work, which we're grateful for, but they said to us, over the period of the holiday, gearing up for Christmas, gearing up for school break, just like logistically, there were practical concerns around having the kids in school full-time for the week of Christmas. So yeah, we listened to them. By the way, we've been listening to them the whole time, right? We have weekly Zooms with superintendents. We've been working and listening to them the whole time. So I haven't really changed my view. We want as many kids in school as much as possible. School is safe. But we also thought over the holiday, when there was a break coming up anyway, it made sense to, go virtual for a few days and then let them ramp back in January.
The sense is there's this now antagonistic relationship with the comments that you make here and what the reality is on the ground. Do you think that's hurting our relationship?
I don't think that's true. If that was perceived, there was absolutely no intention of that. And I don't think that that is the case. I think the reality is we have worked together very well. You know, they've asked for ramped up testing. We're going to be delivering on that. Our K-12 testing system is really best of class in America. We're pushing out 6,000 HEPA filters because we've heard from them that's what they want. So it's, yes, there's been some tense moments, but by and large, we've worked hand in glove, and the majority of kids have been in school as much as possible. What I would say is this: I kind of feel hopeful that now we've moved to a place where the discussion is, we're no longer asking, should kids be in school? We're kind of have edged to a place of saying, yes, they ought to be in school. How do we keep them in school?
Governor, you've credited the pause with helping stabilize our situation right now. What would you say to somebody who's concerned that we're now opening up too quickly and that we're going to be right back in the same situation, especially when it's still really fragile? We've still had over 5% positivity a lot of days, still had more than 50 new hospitalizations a day, which have been the benchmark for reopening.
Yeah. So, listen, we are definitely not out of the woods, and I hear that concern. I would say that's exactly why we're doing a phased reopening. So on Monday, we're not going back to 100% capacity in restaurants. We're moving up to 50%. We're not going back, we're slowly reopening, which is why I put that slide up. And we'll watch it. We also have the vaccine coming online, which is going to help us. We're tripling our testing. So it is a daily thing that we'll monitor. But given where we are and the fact that certain businesses are really suffering because we closed them, I felt it was appropriate to slowly dial it up, layer in more testing, and with the vaccine coming out.
Some experts have said that the pause rules didn't even go far enough, especially with indoor dining. Other states, other locations have closed them.
No, listen, I hear it. It's very tough to make these decisions, and you only know, like in hindsight, if they were effective. There is absolutely no one answer or one perfect answer. That's what has made this so hard to manage through, because there's this constant tension between the economy and public health, and I'm trying to balance them both. So what I chose to do was a limited duration pause, only 3 weeks, pushing out a huge stimulus, biggest one in America that we could find per capita, and then slowly reopening, along with a lot more testing. So I talk to as many experts as I can. I look at the data, I listen to the experts, and then as a team, we make a judgment call.
Bouncing off that, you've said that people ignored a lot of the Thanksgiving guidance. Why do you feel they will follow it for Christmas and these holidays coming up?
I'm hopeful that people will. A lot of people didn't ignore Thanksgiving. A lot of people did keep it to their home, or I knew a lot of people that had their Thanksgiving dinner in their garage with the garage open. So I think people, by and large, did follow the rules. I think people will, by and large, follow the rules again. The other big difference this time is go get tested, right? Like, I wasn't able to say that for Thanksgiving. We didn't have the capacity. But if I hope you don't have your in-laws over or something for Christmas, but if you're going to, go get tested the day before and the day after. And if anybody is positive, isolate or get your KN95, like the doctor said. So that is one difference now. The testing, everybody go out and get tested next week and the week after.
I've actually heard from some restaurant owners that are concerned about the end of the pause, because right now they have workers who are laid off that are getting the $200 bonus. So when the pause ends, they will not be able to supply that unemployment bonus. Is that something you'd extend, or I guess maybe this is a question for Congress, I'm not sure who, through the next phase, if you will, where you're going to 50% capacity? So those restaurants that say, hey, you know what, the numbers aren't where we're comfortable opening up again. Is that something you consider?
No, I get what you're saying. Thank you. We are on money. We've used all of our stimulus, so that is not something that's on the table. However, in the bill that is hopefully going to go through the Senate, the United States Senate, the Congress today, there is additional relief for individuals. And I call our federal delegation every single day to say, where are we? Is that happening? So I am hopeful that that is going to happen, and then that'll pick up right where ours leaves off.
And if I could ask each of the two doctors, Dr. McDonald, Dr. Chin, would you feel comfortable eating inside a restaurant? Would you take your family to eat indoors at a restaurant sometime in the next couple of weeks?
My wife is such a good cook. I just want to get that right off front with you, man. But I will tell you, she loves going out to eat. And Italian is what we enjoy. I do enjoy good cannoli. There's a lot of good Italian restaurants in Rhode Island. So, yeah, so when we go out for dinner, though, my wife lived in Italy for 2 years. We have high standards. You bet I'd feel comfortable going out for dinner in the next 2 weeks, and we would dine. In other words, it'd be a nice restaurant, and we would do that. And I think it's possible. You just obligated me to a meal in this week. So I guess I'm going somewhere for dinner in the next week. So how's that? Dr. Chan, I'd love to see what you say with this.
Well, I'm going to have to compliment my wife on cooking, and she is a good cook. I also love to cook, so I cooked for Thanksgiving. But I've been out to eat a few times during the pandemic, and I think it's, what I've been seeing is that it is incredibly impressive. The restaurants are adhering to physical distancing. People are masking when they're not eating. The waiters and waitresses are always masked. So I feel comfortable, and I have felt comfortable. I think the winter's a unique challenge, right, because everything has to be pushed indoors. But I think with the spacing rules and everything I've seen, I've been reassured, so I'm comfortable.
Workers should feel comfortable, folks who are on the front lines of interfacing with multiple families throughout the course of the night. Based on what you've each observed, do you believe that there's no particular risk for someone who's working as a waiter right now, or waitress?
I believe the risk is minimal. I mean, again, from what I've seen is the waitresses and waiters are masked, which is fantastic. They, there's hand sanitizers and gels at these restaurants, and I see them using it. And with the physical distancing as well. So we have seen some cases in restaurants, but I think if we all adhere to what we've been preaching, what the governor's been saying every week for 9 months, then I think it's going to be pretty safe.
Lieutenant, while you're up there, can you clarify the vaccine dosage situation? Because we've heard just in the last couple of days so many different things. Initially, we heard that they were able to squeeze out more from the vials that they already have. So then where does that put us? But then we heard about the lower amount coming in with this latest shipment. Then we're hearing that Pfizer actually has those doses sitting in a warehouse. It's just a matter of the federal government distributing it properly. What's the actual situation with that?
Yeah, it's a great question. So I think what you're alluding to here is that there's so many unknowns and things we're hearing about every day, and that's one thing that's made it really tough about vaccine implementation. I think to your point about the vaccine doses, every time a physician, a clinic, a nurse gets a vial of medication, there's a certain number in that vial. And what people have realized with the Pfizer vaccine, is that it's been reported that there's 5 doses in there. Well, there's actually 6 or even 7 in there. And in normal world times, non-pandemic, other diseases, those last couple doses, those remnant doses, aren't always used. But because of the shortages of the vaccine, obviously the demand is that we want to make every single dose count. And so it was actually very reassuring and exciting to hear that there were potentially 2 extra doses per vial of vaccine. So that's been endorsed now by the FDA that you can do that. You can get 6 or 7. So that's, if you think about it, from a dose of 7 compared to 5, that's almost 20% more, right? So that's good news for sure.
I have a question about testing at schools, either the doctor or governor. Aren't rapid tests more accurate on people with symptoms? And so why are you using them for the asymptomatic K-12 testing system?
Yeah, it's a great question. So we do know that the rapid point-of-care tests are more sensitive, and if you look at what the FDA and the guidance that they've released, they are more sensitive in people that are symptomatic. We have hundreds of thousands of Binax tests at the moment, and they are certainly accurate to some degree, not quite as good as symptomatic people, but they are really good as well in people that are asymptomatic. I think the other key point to remember about this too is that these antigen-based tests are going to pick up people who are actively shedding virus as well. So it may miss some people who have lower level infection, but the people that they are picking up are people that are actively shedding, are most likely to transmit, et cetera. So we've talked to experts, we've talked to our testing and validation task force, and they all agree with this approach and think it's reasonable, and it's a great way to get testing out there.
Governor, the Department of Health released a a study paper a couple weeks ago that's showing in the first 6 months of 2020, fatal overdoses on drugs are up almost 26%, and opioid-involved overdose deaths are up almost 33%. What's the state's plan to handle overdoses during the last months of the pandemic?
Yeah. So what you say is correct, and it's beyond heartbreaking. We have been fighting the opioid pandemic and crisis for the past years, and it's gotten so much worse during COVID because people are isolated. Mental illness, depression is through the roof. People are isolated, they're alone. It's also been hard to go see a therapist, go get your treatment, get to the doctor's office. So a few things. Again, as I was saying earlier, in the current bill that is on path to pass in Congress, there is a good chunk of money for addiction. And we would put that to work immediately to increase our efforts to help folks struggling with opioid addiction. So what does that look like? Continued medical-assisted treatment in the prison, more medical-assisted treatment in the community, a lot more outreach, a lot more in the community, peer recovery coaches, street workers in the community there. Continued use of telemedicine. So we have allowed, required actually, telemedicine to be covered equal to in-person visits. One of the areas that is extremely helpful for is, visiting a therapist. So we would look to continue that and maybe expand that. So I think the short answer is it's horrible. I'm I guess proud of the fact that Rhode Island is recognized as a leader in America for the work we've done around overdose, and we are just going to, it's a very top priority in the new year as we focus on it. The last thing I'll say is I think we need to be more aggressive in launching a recovery-friendly workplace initiative, because having a job is key to being able to sustain your recovery. But in this job market, it's hard for anyone to get a job, and if you have had addiction or you've spent time in prison due to having had an addiction, we got to be right there for you. So the Back to Work initiative that I've launched, we are focusing on people who are struggling with addiction to get them a job. So anyway, it's a complex topic, all of which is to say we are on top of it and we need to do more.
Governor, you obviously put a lot of emphasis on increased testing. And a couple of questions here about why is this, possible now? Who's going to be doing those tests? Is that state-run? And then also you mentioned that the pop-up tests would start as of Sunday. And in your list, I believe you mentioned gyms. Would they be opening on Sunday or Monday at the end of the pause?
Okay. So the gyms can open on Monday. When I was saying Sunday, I was referring to malls, grocery stores, Roger Williams Zoo. I really just didn't want people to be surprised if they're going to go out to Garden City and do some Christmas shopping and they see a pop-up test. That's like an official thing, and it's safe, and you should go ahead and, if you see it tomorrow or Sunday. We're going to be layering them in over the coming days. But no, the pause lifts Monday, so gyms will be open on Monday.
No, the gym ones are for the customers of the gyms themselves, so those aren't open enrollment.
Right, yeah. So he's saying if you go to the gym on Monday, it's for the customer of the gym. I'm sorry, what was your other question?
The other question is who's going to be doing
who does the
tests?
testing? Thank you. Oh, you asked how do we get the supply? Yeah. So most of what I'm announcing now at supermarkets, malls, etc., are these Binax kits. They're the ones that Dr. Alexander Scott showed the other day. So it's you don't need any equipment. You can do it yourself, really. You can do it yourself. You swab yourself, you put it in the cardboard, you close it, and you let it sit there for 15 minutes. So I actually went to the federal government and asked for a lot of them. Dr. Burks was terrific. I appealed directly to her when we started to get into trouble, and we asked for an outside shipment, and they have delivered. So now we have a pretty good stockpile in Rhode Island of, like at this point, over 100,000 of those tests in our possession, and we're looking to get them out. The National Guard is going to be heavily deployed to do this. We're hiring people, temporary workers, Department of Health, and again, it's pretty simple. We're also doing like a train the trainer model. So the Guard will, if let's say you wanted to do it at your, I don't know, at school, we're going to be teaching people how to do it because it's really very simple.
To follow up on the school testing, how do you envision people either signing up, or is it people just going to come through a line? There's going to have to be parental consent for this on-site school testing?
So there's two ways that we're going to do it. One, and this is why we went to the superintendents and we asked them, which do you want to do? One way is they say we want a testing event. So like next Tuesday, we're going to have a big event and test everybody. So yeah, parents would be notified, teachers would be notified, we would send people to the school on that day and test everybody. The other way is like a cyclical thing, a random testing of a sample every 10 days. And same thing, yeah, no one will be forced ever. No one's ever going to be forced. We will ask. Teacher says no, we respect that. Parent says no, we respect that. But for everyone who says yes, we'll do it on site. And again, over time, we're hoping to get the schools to be more and more independent, to just kind of do it on their own.